Welcome everyone. Thank you for joining us. I'm Work in Progress, and you're watching the DSM-5 Explained. Today, we'll be looking at Reactive Attachment Disorder, or RAD. This selection of disorders is just as frightening as it is sad. How would you feel viewing everyone around you at all times as a potential threat, just waiting for you to drop your guard or show weakness? Think of how many experiences in life that should be moments of joy are instead seen as horrifying fights for survival. On top of this, imagine not having the social tools to help navigate any of these experiences. Now, before we continue, as always, the video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. So, what sorts of things may indicate RAD? Well, I'll give you the DSM-5 criteria, and then I'll attempt to make it a little bit more digestible. Now, it is important to remember that unlike physical medicine, the field of psychology can't just run blood tests and conclusively say you have X disease. Instead, we have to rely on a suite of symptoms coupled with an experiential history to draw conclusions about what label to ascribe, and therefore what treatment path to pursue. With that said, here's what the DSM-5 lists for the diagnostic criteria for RAD. The DSM lists 7 multidimensional criteria to potentially diagnose RAD. They are as follows. 1. A consistent pattern of inhibited, emotionally withdrawn behavior towards adult caregivers manifested by both of the following. 1. The child rarely or minimally seeks comfort when distressed. And 2. The child rarely or minimally responds to comfort when distressed. Next, they must experience 2 out of 3 of the following. Minimal social and emotional responsiveness to others, limited positive affect, and episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interactions with adult caregivers. The child must have had experienced a pattern of extremes of insufficient care, as evidenced by at least one of the following. Social neglect or deprivation in the form of persistent lack of having basic emotional needs for comfort, stimulation, and affection met by caregiving adults. Or 2. Repeated changes of primary caregivers that limit opportunities to form stable attachments, i.e., frequent changes in the foster care system. Or 3. Rearing in unusual settings that severely limit opportunities to form selective attachments, i.e., institutions with high child-to-caregiver ratios. The final 4 criteria are more caveats than actual experiential events. 4. The care in Criterion 3 is presumed to be responsible for the disturbed behavior in Criterion 1. 5. The criteria are not met for autism spectrum disorder. 6. The disturbance is evident before age 5. And 7. The child has a developmental age of at least 9 months. So what does this all boil down to? Well, it means that if a child is over the age of 9 months, doesn't meet the criteria for autism spectrum disorder, and has suffered extreme neglect evident before the age of 5, it's possible that they may qualify for reactive attachment disorder. This isn't meant as a definitive measure, though. Instead, it is only a framework to build from. If the individual has this history and is currently displaying things like fear at what others may consider harmless situations, as well as a lack of positive affect, or not showing outward signs of being happy or relaxed, it may lead a clinician to lean towards an RAD diagnosis. Someone with RAD may appear stoic or able to go through situations without any outside help, but this couldn't be further from the truth. Instead, This generally stems from their early development lacking someone who would or could help meet their basic needs when they themselves could not. Due to this, they learned early on that when stressful situations arose, no one was going to help them, and any attempt to seek out help would be met with punishment, or worse, indifference. Now that we understand the basics of what RAD is, some risk factors, and how it can manifest, what can be done to help those afflicted with this tragic and frightening malady? Well, according to the Mayo Clinic, there is no standardized treatment for RAD, but this doesn't mean there isn't hope or a way forward. While standardized treatment has yet to be developed, it is recommended that the treatments include encouraging a child's development by being nurturing, responsive, and caring, providing consistent caregivers to encourage a stable attachment for the child, providing a positive, stimulating, and interactive environment for the child, and addressing the child's medical, safety, and housing needs as appropriate. To this end, therapies such as play therapy, art therapy, animal-assisted therapy, eye movement desensitization and reprocessing, or EMDR, trauma-focused cognitive behavioral therapy, and parent-child interaction therapy have all been effective in the treatment of RAD. I'll go into each of these more in depth in future videos. So, while reactive attachment disorder is a difficult place to come from, with the proper support, those suffering from it can find the peace and the hope that they've been deprived of for so long. Hey y'all, I named this channel what I did for good reason. I wanted a constant reminder that as accomplished as one may feel, we are all just works in progress. I am no different than anyone else in this sense, and I need your help to grow and learn. I put my heart into each of these videos and have a great time doing it. However, in order to make these videos the best they can be for you, the viewing audience, I'm asking for your feedback. What you like, I'll keep, and what isn't as well received, I'll do my best to correct. We are in this together, and if your comments are particularly poignant, I may even feature them at the end of a video. Wherever you are on your journey, just remember, each and every one of us are simply works in progress. See you next time.